Hi, everybody. This is my Tilt W for week four. So, things that I learned this week on week four. To begin, I'll start with this is my second week of rounding after my two project weeks and a third week of rounding. Sorry, first week of rounding. So, this is week four total, and I have 2 weeks left in this rotation. So, to start, in things that I'd like to start more of, I think really trying to be more proactive about things. That's probably the biggest thing I would say about what I would like to do in these last couple weeks. For instance, a lot of the times I have to be prodded and poked and suggested about what to do in certain situations, such as finding discharge meds or looking at therapeutic drug monitoring. And I would like to, in the next few weeks, really become more on top of that. For instance, instead of having Dr. Carlson ask me a question, I'd rather tell her what I think and then see if whether she agrees or not, such as this patient is on warfarin, their INR is this, can I change it? Or like, I would like to change it to this. And then she gives her opinion rather than her having to ask me. And I think just trying to be proactive rather than reactive. I think that's a huge thing I'd like to implement in the next upcoming week and for the rest of the rotation. And I think that also just doing rounds, I would like to start being more proactive and focus on how I can offer some value to the medical team. Such as we had a couple patients who had to be on comfort medications, and I was only semi-ready really for that. So trying to be more ready for the questions that are going to be asked and to have answers for the anticipated questions, I think is something that I would like to do more of. Really just being proactive. In terms of stopping doing things, I think probably the biggest thing is to stop being too negative or self-critical. I think I sometimes want to be perfect and have a hard time dealing with things I'm not so sure about. And it is only my second week of rotation, so it's understandable that there's gonna be huge gaps in knowledge. Like Dr. Carlson did two residencies and has worked as a pharmacist for many years. And I think sometimes when I don't know an answer to a question, I'll get down on myself. And I think that it's just normal. It's normal to not know everything, and it's going to really take a lot of time and practice too. And like, I don't think it's going to be completed even by the end of this rotation. But really trying to keep a positive attitude despite not doing things perfectly or doing things well. Like, I'm here to really to learn, and I think that that's something that I constantly have to remind myself. So really, I can't be too critical on myself and too harsh on myself, and really just being okay with not knowing. Like, everything for here is really a learning process. The other thing is to also stop being too reliant on technology and information. And what I mean is really, whenever there are questions that are asked, I panic a little bit, and then instead of trying to rationalize and think through a problem, I just start like looking up answers and using the internet and stuff like that, which is fine to a degree, but I think I definitely know a lot more than I give myself credit for. And then this is also demonstrated during farm rounds where I was about to start Googling answering the question, and then Dr. Carlson told me to stop and just to think it out, and then I was able to think it out for a rationale. So really, I think that if I don't know something, to not panic right away and just to give myself a little bit of time to think and rationalize about something. I think that it's really easy to be down, I think, and then think that I don't know very much, which is true to a degree, but I think I do know more than I give myself credit for. So I think those are the things I'd like to stop. And things in areas that I would like to continue, I think that really, probably the thing I'm most proud of in the last couple weeks is really my improved patient pre-round and farm round cases. At least from my perspective and eyes, they're progressively getting better all the time. By no means are they perfect, but I think that really think that each time that I work up a patient, I'm becoming more and more efficient, and my assessments, especially, are really becoming better, and really beginning to take shape. Like, of course, they're by no means perfect and have a long ways to go still, but I feel a lot happier with what I submitted compared to my first patient case to now, and I feel a lot more comfortable working at patients and giving rationales. So I think the next week just got to continue to keep improving and trying to find areas where I can just give better evidence-based rationales, such as the guidelines and doing scores such as the Padua or the TIMI score, and just to really be more comprehensive. The more questions, I'd like to be able to answer the why questions more and more, and I think that I'm doing that over time, and I think that it just needs more time. So I think I'm proud that I've made improvements in my patient cases and my presentations, and I want to continue that. And really, lastly, I would just like to really continue to be willing to learn and improve and to have a positive attitude about the rotation and my role within the team. I think that if there's gaps in the knowledge, I think that I just got to continue to acknowledge them, and then just to continue to work from there, and really try to stay positive about what I know. And I think that those are probably the biggest things I'd like to continue. Like, I think at times can be really easy to be discouraged, and I think that, or like, yeah, or like mad at myself for not knowing something, but that's really the only way to learn. If there's not something you know, really trying to find out what the answer is and learning from that, that's the best way to learn, really. And if I knew everything, then I wouldn't be on this rotation. So, yeah. So those are things I would like to say in my Tilt W for week 4, and I look forward to having another full week of rounds and improving on my patient cases, and really just becoming a better and better rotation student. I'm excited to improve. So thank you guys all. Hope you guys are doing well.